Cynthia, school hasn't even started yet, and there are already 2 confirmed cases of COVID-19 in the Peel District School Board. An administrative worker at the Northfield office in Brampton and a teacher here at Ross Drive Public School. A Brampton teacher we spoke with says she would feel a lot safer coming back to work if teachers were tested consistently for COVID-19.
A matter of time.
Before what?
Before we start getting sick.
This Brampton elementary school teacher feels unprepared and unsafe going back to the classroom. She wants to remain anonymous out of fear of losing her job.
Well, I'd feel safe if my class was smaller so that we could move the desks a little bit and actually have the proper distance. I'd feel safe if we had the proper PPE. We were given flimsy face masks with an elastic to put on. Then I think we should have something covering our clothes.
That anxiety intensifying after Peel District School Board confirms a second staff member tested positive with COVID-19 today. That case is an administrative worker in the Northfield office. PDSB says Peel Public Health is investigating and contact tracing. Just yesterday, the board confirmed a teacher also tested positive. The PDSB told CityNews the teacher wore a mask and maintained social distancing while they were in the building. Also adding there's no risk to the school since the person didn't work during a time they could easily spread the virus. Soon, this will not be the case as teachers and students start heading back to the classroom in just a few days.
It seems to me that we would all be well served if teachers were tested at least weekly, perhaps twice a week, at least to begin with, at least for the first few months while we're entering flu season, while we're doing this unprecedented reopening.
If that were to happen in Ontario, where there are roughly 160,000 teachers, epidemiologist Colin Furness says labs would be processing more than 300,000 tests each week on teachers alone, which is why he has another recommendation.
Pooled testing involves taking several test samples, something like 8, mixing them together and performing one test on all 8. If they're all negative, you're done. If it comes up positive, then you have to go back and retest each individual one. But because we're expecting negative tests for the most part, because COVID is under control right now, this is something that would really let us up our game. In other words, without having to hire more lab techs or build more laboratory space, we could increase our testing capacity by almost 10 times.
I do think teachers should be tested, but we can't be going and teaching and then going it would have to be convenient. It would have to be on the school location, like a nurse maybe. Well, it's kind of hard when we feel this way to go to school and make the kids feel safe and like they don't have to worry.
Furness says he wants to see support provincially and nationally for paper-based saliva testing. He says it's quick, cheap, and could be done at home, opposed to people simply crossing their fingers, hoping we could keep things under control.